Yeah, good morning, everyone. Thanks for being here. I think first of all, I just wanted to also say thanks to ASC Studies Club for organizing this town hall. I think this is good opportunity and platform for the course team to meet up with the students to also answer some questions, because I think on off, students do message us or send us text messages via Teams to ask us questions like what are the elective clusters, what are the internship opportunities, things like that. So I think having this platform here can answer some of these questions, which I think many of you may have very similar questions. So do keep your questions coming. I don't have any like big major announcements, but I thought probably we'll leave more time for Q&A. And definitely in the during this 1.5 hours, try to answer as many questions as possible. And then I will also probably take the opportunity to also share what are some opportunities for you all to, like, say, build your portfolio, or some of you are interested in scholarship, sponsorship, things like that. Yeah. But I think I would just like to take a few minutes to promote our Join Poly event. So which I think you all would have already known about the event through email and also through WhatsApp. Okay, so just gonna bring you to the microsite for a while. Okay, yeah, so you should be able to see the my screen, yeah? Okay, so this is our microsite for the joint Polytechnic and ITE Farm Science e-forum. Okay, so this is a joint poly event, meaning that it is involves 5 different polytechnics and also ITE College East, and TP, Diploma in Farm Science, is the organizer for this year's event. So I think the course team has put in a lot of effort to put up this program. So the main event is on 13th of October. So all of you are supposed to attend. It's a compulsory event for all pharmaceutical science students. Okay, so please register if you have not registered yet for the main event. And I also want to take the opportunity to also encourage you to take a look at the further education and career webinars. Okay, so if you click here, you will see that there is 2 tabs here, which is the education and the career webinars. Okay, so here we have invited our overseas partners, our universities partners, as well as our industry partners to do sharing session with our students, because previous years the Joint Poly ITE Farm Science Forum is done face to face. Okay, so usually the industry partners, the overseas partners will be there physically to set up their booth to interact with the students, to to share with students about what are the career opportunities, what are the overseas education opportunities. But unfortunately, because of COVID, everything is now online, right? It's virtual. So but they have very they're very supportive, so they have put up webinars for our students. So I really encourage you to take a look at all these career webinars, as well as the education webinars. Okay, particularly, all these are our overseas partners. We work with them on study trips. So it will be a good opportunity for you to meet them. I think I saw some question about study trip in the Q&A. Okay, so now we can't travel for the time being, but definitely, you can sign up for this webinars to interact and to meet with our overseas universities partner. Okay, and also we have our local university partners such as SIT and also SUTD. Okay, so I think many of our students are applying for further studies in SIT. We see increasing number of students going into SIT in doing allied health programs and also pharmaceutical engineering. Okay, so I really strongly encourage you to check out these 2 webinars, because these are just some options for you to consider when you graduate from the diploma. Okay, so please take a look at the microsite and sign up. Okay, yeah. So I think we can proceed with Q&A, right, Jedediah?
Yeah. Okay, thank you, Dr. Maisha. Okay, can you all see my screen now?
Yeah, can.
Okay. So thank you, Dr. Maisha, for the announcements. And we'll be showing the guidelines on how to enter Pigeonhole again. You can take your time to scan the QR code.
Okay, now we'll be moving on to the Q&A section where questions submitted before the event will be answered first before those from Pigeonhole. Okay, so firstly, let's dive into questions regarding electives. So the first question is, what electives do we have to choose and how should we go about choosing?
Okay. Yeah, before I answer the question, I also wanted to say, I think Miss Shahida is also with us. Okay, so definitely, she can also help take some of the questions. All right. Okay, so elective cluster, very commonly asked question, and particularly for the year twos, I think all of you, the year two students, you'll be selecting at the end of this year your elective clusters. Okay, so probably there's only 2 elective clusters. So, maybe you can toss a coin, head, then pharmacy practice, tail will be pharmaceuticals and biologics. Okay, so these are the 2 elective clusters, pharmaceuticals and biologics, and then the pharmacy practice. Okay, so maybe I just share a little bit, our PHS course structure from year 1 and year 1, year 2, right? Basically, it covers 2 different, I would say, groups of subjects. Some of the subjects are more clinical in nature, where you will learn about, drug action, what are different classes of drug, where you learn about patient counseling, things like that. So this will be your subjects like, IPP, which the year ones will be taking in coming October SEM. Then IPP stands for Introduction to Pharmacy Practice. Then Pharmacy Practice 1, Pharmacy Practice 2. So this is really to build your drug knowledge and also to equip you with, patient counseling skills, how to do drug dispensing, etc. Okay, then the other groups of subjects will be more like, your more lab-based kind of subjects, such as pharmaceutical analysis, pharmaceutical manufacturing technology, BTA, bioprocess technology analysis. So all this actually is to prepare, equip students with the skills, the lab skills to later, work in, say, more industry kind of placement or, job scope. Okay, so the nature of these 2 groups of subjects are quite different. Okay, so I would say after you are, after you went through, like say year 1, after 2.1, you probably will get a feel of, whether you actually prefer more of the lab-based kind of subjects or maybe the more, pharmacy practice, the patient counseling kind of subject. Okay, so I think this is one way students actually, help. I mean, this is one way how students decide whether to choose pharmacy practice or the pharmaceuticals and biologics. Okay, so these two elective clusters also is tied to internship. So I think this is another consideration. So for students who are, very keen to, you prefer something that is more patient fronting, you like to interact with patient, then they may choose the pharmacy practice elective cluster. Okay, then for students who like to more like work at the back scene, like to be in, in a more lab environment, in a plant. When I say plant means like, in a manufacturing plant setting, doing like say QC, quality control, where you are in the lab running tests and all that, then they may choose the pharmaceuticals or the pharmaceuticals and biologics elective cluster. Okay, I also want to say to the year twos, definitely in the coming Flex Week, we will be organizing a decision-making workshop. The purpose is really to help you to decide which elective class. It's not the, it doesn't mean that you do that workshop. It's the only way to help you to decide, but rather it gives you a better idea what is your strength, your weaknesses, and then you help you to better decide which elective cluster to choose. And of course, definitely the Joint Poly Forum is also another platform for you to understand a little bit more about the 2 elective clusters. Yeah, so that will help you to choose. Okay, so I hope I answered that question.
So the next question is, what are the details about the specification and criteria, if any?
Okay, so for the 2 elective cluster, I think specialization means the 2 elective clusters, right? Basically, for each elective cluster, students will need to fulfill 2 subjects. So every elective cluster, there is 2 subjects. Okay, so each subject is, one is 4 CU, one is 5 CU, total is 9 CU. So all students will need to complete 9 CUs in order to fulfill the graduation requirement. So when you are in year 3, if let's say you choose the pharmacy practice elective cluster, you will then do the 2 subjects under pharmacy practice. Then if you choose the pharmaceuticals and biologics, then you will do the 2 subjects under the pharmaceuticals and biologics. Of course, the 2 subjects will be relevant to the elective cluster, right? Like, so pharmacy practice, the 2 subjects will be more to, you know, equip you with the knowledge and skills to do something that is more, you know, patient, you know, interacting with patient, to, you know, promote medication adherence, to help to promote lifestyle modification, to help patients to manage their health, or, you know, their disease conditions, so on and so forth. Or, I mean, there's also a subject where students will learn about drug laws, as well as, you know, how the inventory management, what are the you know, operations of a retail pharmacy example. Okay. Then for the other elective cluster, the 2 subjects, which is pharmaceutical unit operations and biopharmaceutical processing. These 2 subjects will prepare students for work in the manufacturing industry. So they will basically cover things like what goes behind the scene in manufacturing of, you know, your pharmaceuticals and biopharmaceutical drugs. Okay. Criteria. Elective cluster, there is no criteria. The selection, as I mentioned, is end of the year, which is at the end of term 1 in 2.1. Means when you are during the vacation period. Sorry, not 2.1, 2.2, semester 2.2. As of now, the system is on a first come, first serve basis. It's not by merit. Okay. So when the elective cluster selection period is open, there'll be some briefing done before that as well, to share with students when is the period of registration and all that. Then you just need to go onto your, you know, the TPOSS to do your selection. Okay, so it's as of now, it's by first come, first serve basis. Okay. Of course, I also wanted to mention, because for the pharmacy practice elective cluster, it is one of the component is the work-based learning attachment, where our students, when doing the 2 subjects, right, they actually need to go and do a 2-day attachment at the retail pharmacy. So because of that, right, whether or not you can get into the pharmacy practice elective cluster will also depend on whether, you know, your how to say, whether or not you clear, you know, all the subjects prior to year 3.1. Okay, so so you have to make sure that you've cleared all the, you know, your subjects prior to that. Yeah, so I think that is probably the only thing that may affect the selection. But if not, just wanted to again emphasize, it's not by merit. I also want to mention that besides the 2 elective clusters offered by Pharmaceutical Science, there are also other elective clusters offered by the other diploma. So each diploma will have our own preferred elective clusters that is relevant to our own diploma. But a small number of students can, you know, go and select electives cluster from another diploma. But usually this is catered to, you know, not a very big number, a small number. Okay, so this is really to actually promote interdisciplinary learning, where, you know, we encourage students to learn, you know, beyond you know, the current scope that you are learning. Okay, maybe later when there is opportunity, I will share a little bit more about interdisciplinary learning, because it is something that you definitely will hear a lot and will be involved a lot in the coming semesters. Yeah.
So the next question is, are specializations suited for a certain group of students? Do you like answer that already?
I think in a way I did, because I think I mentioned, like, depending on what is your, you know, your preference. You know, there are students who really enjoy doing role playing. You know, I think the year 2s, you all will be probably know what I'm talking about. The year 1s, I think, is something that you can look forward to in 1.2. Okay, so I think it really depends on what is your interest, and definitely what is your strength as well. Okay, so I would say choose something that you like, you enjoy doing. If you find yourself enjoying lab a lot, you know, doing lab work, you know, you then probably you know, that will help you to guide you to choose you know, the elective cluster. Similarly, if you are somebody who, you know, you foresee yourself working in the healthcare sector, and also, you know, interacting with patients, then that will also help you. And I also want you to also think through properly when you make the selection, because like I mentioned, the elective cluster is tied to internship. And after internship, you are graduating. Some of you will be going to work immediately. Some of you will be furthering your studies. So your internship does play an important role, especially if you are very keen to, your plan is to, find a job immediately after graduation. Then that's where, your internship can potentially be, from internship, it can be converted to a full-time position. That is not unusual. We see many of our students who are, being offered full-time position right after internship. Okay, so that's why I think you have to think properly when you choose, your elective cluster. Okay. Yeah.
The next one is, what are the electives and fundamentals taught in this course? But okay.
Okay. So I think the elective I've covered that part. So elective is done in year 3, right? Fundamentals will be things that you have probably you have already learned, like in say year 1. So year 1 subjects are usually a bit, are the more fundamental kind of subjects. Like all of you have gone through HAP, Cell B, PIPC, BMIG. Yeah, so they basically build your foundation in biology, chemistry, so as to support later, the other subjects, the specialized subjects in year 2 and year 3. Okay, so I would say the core knowledge that all pharm science students should have is really, drug knowledge. Okay, that's one. So because, you'll be taking like 3 pharmacy practice module in year 1 and year 2. So you definitely will be in some way, like drug experts lah, in a good way. Okay, so you definitely have a lot of clinical knowledge. Another very important or core skill set of fundamentals for PHS student, I think, is really the patient interaction, the patient counseling skills, the patient communication skills. It's very different from normal communication skills, right? Because I think when you start doing your pharmacy practice subjects, you will learn that there are certain things that you need to take note of when you're communicating to a patient, right? Okay, so that's one core skill set, and it's very, very important. Of course, the other core skill set will be, lab skills, good lab skills. Okay, because in the course of your study, you will be doing things like pharmaceutical analysis, pharmaceutical manufacturing technology, etc. And I want you all to also be reminded that, when, as a pharm science student, what you do has a direct impact on patients' lives, be it directly because you interact with patients, so that's where your drug knowledge comes in, the patient counseling skills comes in. Then the other, group of students will be behind the scene where they are involved in doing involved in drug manufacturing, drug testing. The core skill set there is that, of course, you must have good lab skills. You must have compliance to what we call current good manufacturing practice, which is a very, very important skill set, or rather a very important subject that all pharm science students should know. Okay, and because it is this good manufacturing practice, this set of guidelines that ensures that everything that is produced, manufactured in the manufacturing industry is, complies to the quality standards, so as to, ensure patient safety, so on and so forth. Okay, so I think being pharm science student, you should know that, whatever you do has a, like later on when you graduate will have not just before not just graduate lah, but during internship already, what you do actually has a very direct impact on patients' life. So I think that is the very important core skills sets that you have. Okay, and yeah, so so I think I hope I answered that question.
Okay, so next question is, how will I know which elective cluster is better suited for me, as I'm still on the fence and cannot decide which I prefer?
I believe this one I touched on a little bit. Definitely interest, right? Just now I mentioned about your strength. If you know that, of course, I think as students, right, you all will, you are very, how to say, pay a lot of attention to your CGPA, right? Okay, so of course you want to do something that you want to improve your CGPA. That is understandable, okay, right? But I think do consider the things that I said just now about, your interest and about what is your plan after graduation. I always believe that if you're interested in something, you're passionate about something, then that will that will motivate you to do well, right? Rather than to be in something that you are not so interested in. Okay, so so do consider those things that I've said. Of course, if you're still not sure, please come and talk to talk to me, Shahida, talk to your CPs, because these are, all the resource persons that you have, we are your lecturers, but we are also there to provide you guidance, advice. So don't be afraid to approach us if you're not sure. Talk to your parents, talk to your seniors. So we will be, organizing things like, your senior sharing incoming flex week for the year twos. So for them to share with you all about their internship experience, about their EC experience. Then, like I mentioned just now, the decision-making workshop. It is a workshop that, brings you through a series of steps to help you to sort of like identify which one may be a more suitable EC for you. Although, like I said, it's only 2 lah. It's not like there's 10 there to choose, right? Yeah, but I think still, for some people, it's like both you are interested in, okay, then perhaps it's choosing something that you have more interest in, and also bearing in mind the internship placements. That I think that will be also important. Yeah.
Okay, now we'll be moving on to job scope and career paths. Where can a diploma in pharmaceutical science get me to?
All the places you can. There's a Dr. Seuss book, right? All the places you will go. Okay. So the diploma in pharm science, our diploma is quite broad-based in a sense that it is not like just to prepare you for healthcare or to prepare you for the industry. When I say industry, usually when I say industry, it means like the manufacturing industry, or like say research, for example. Okay, so because I shared just now in year 1 and year 2, you actually do both types of subjects. So you have clinical knowledge, you also have, industry knowledge. CGM, you will learn CGMP, you will learn about, pharmaceutical analysis, and then, so all these things prepares you for the different job sectors of the pharmaceutical industry. So you can go into quite a variety of sectors under under pharmaceutical science industry. So definitely one of the most one of the core or rather course outcome, it is to train our students to be pharmacy technician. So definitely you can find jobs, can go and work as a PT, pharmacy technicians in the hospital setting or in the polyclinics or in the retail pharmacy or even in healthcare supply chain. Okay, so to be honest, all these things you can hear from next week's forum, because we have all our industry partners from all these various industry. Okay, in particular, right, there's one particular webinar by Mr. Ambrose Chan, who will be sharing with you with, the different skill sets, right, which industry is actually more suitable for you. He has given a webinar, I think, to our year 3 students earlier this year, and I thought that was really, really very helpful, because it really show you that, you're not just limited to, say, working in a hospital or working in manufacturing, but there's actually other areas you can venture into. Okay, so so going back to pharmacy technicians, definitely hospitals, retail, clinics, etc. And I want to emphasize also, they are actively hiring, right? Many of our graduates that graduated in May, they are working as PT in various hospitals. Okay, so we have a lot of there are a lot of openings, opportunities for openings for pharmacy technicians. Then the other industry, of course, is the manufacturing industry, where you can take on different job roles, because manufacturing industry is quite broad. There is, in the manufacturing, in a pharma company, there is, like, for example, R&D, which is doing more research. That means before production, where, it's more like, trying to work on something that is probably new and novel. Okay. Then there is also production, means once something is already being, all the studies have been done, this is something that can be turned into a viable drug. Then that's where production comes in. So it can be in production. It can also be in quality control, where you are responsible for testing the quality of the raw materials, the intermediate products and the finished products, to ensure that whatever that comes out at the end is safe and is of good quality. Because remember, it's very, very important. You're not just making, like a bag or a computer, or a piece of clothing. We are talking about medications. Okay. Then there is also quality assurance. Quality assurance, I always think of it as like the police lah. They are the ones that, in a manufacturing industry, they ensure that everything that is done in the manufacturing plant is in accordance to good manufacturing practice. There is no like deviation. The SOPs are adhered to very closely, because any deviation, right, you cannot guarantee the end product is safe. Okay, so that's quality assurance. So if you like something that's a bit more, catching people, do auditing, then perhaps this is something that's suitable for you. Okay, then of course there's also pharmaceutical sales and marketing, where you need definitely drug knowledge, but you also need some marketing knowledge. Okay, so in one of the elective cluster pharmacy practice, in one of the subject, pharmaceutical legislation, marketing and management, you will learn some parts of marketing, some basic marketing concepts. Okay, so that's where you will learn about, the marketing, some, what are the things to consider when marketing a product, for example. Okay, so I'm sure many of you would have heard of like pharmaceutical sales rep. Yeah, so this is also another possible job role. Okay, then there's also other areas like I think research I mentioned. You can also go into research. You can also go into regulatory. Regulatory means involving the let's say there's a new drug to be what do you call it? Registration of new pharmaceutical products and all that. So that's where the regulatory comes in. Okay, yeah. So I think that is the range of sectors under pharm science that you can go into.
Okay, the next question is, what are the job scope in the healthcare industry?
Okay, job scope. I think just now I mentioned for healthcare industry, our students mainly their main role they are trained for is pharmacy technicians. Okay, so pharmacy technicians, their main job role is to to assist to support and assist the pharmacists in pharmacy operations, which include things like picking and packing of medication, processing of prescriptions, doing patient counseling, drug dispensing, managing the inventory in the hospital or in the polyclinics or in the retail. So so when we talk about healthcare, say like for example, hospital, in a hospital setting, the pharmacy is also quite different from a retail pharmacy. Okay, so the job scope is slightly different. Okay, but in both like retail and hospital pharmacy, they both employ pharmacists and pharmacy technicians. So our students, after graduation from diploma in pharm science, they will be able to work as PT in both hospitals or retail or polyclinics. Like I mentioned, doing those things that I mentioned just now. Yeah. So that's quite a broad overview of the job scope. Yeah.
Okay, the next question is, can I become a pharmaceutical marketer with only this diploma?
So I think this one is, I suppose it's talking about like pharmaceutical sales and marketing. Yeah, it is. In fact, some of our interns do go into pharmaceutical sales and marketing for their internship. So some of our industry partners, they are the pharmaceutical sales and marketing companies where our interns, they are there to take, they basically they are involved in marketing of the products that the company is selling. Yeah, so with this diploma, yes, because you have the drug knowledge, but definitely you will need some marketing knowledge lah and experience, which some of these things you can learn on the job. You can also take up additional courses. Usually there is I don't see there's any issue lah. You don't. It's not like you need to actually go and take up another diploma in say marketing. Okay, because maybe just to also share like in let's say life science, a lot of my ex-classmates in life science, they also went on to do take on job roles in pharmaceutical as pharmaceutical sales rep, even though they don't have any like marketing background, but the background that they need is really the science, the drug knowledge. Yeah.
Okay, the next question will be, is it possible for us to earn a good income even if we don't enter university after poly?
This is a very subjective question. Good income, what is good, right? I suppose I mean, I understand that everyone, when we are looking for a job, income is definitely one factor, right? Okay, so I don't think I have like a right answer for this. Okay, but I think it all depends on which sector you go into. Okay, I would say, I mean, of course, as poly grads, there is certain market rate for, poly grads when they say go out to work as PTs. So of course, across the different sector, different industry, there's also different market rate, right? A same person with a diploma in say pharma science versus a person with diploma in say business. Similarly, a person with degree in life science and a degree in business, when you go out to the industry, I think the income there'll be some differences. Okay, but what I want to say is just that the income is aligned to what the market is offering lah. If let's say we're as PT, for maybe in the manufacturing industry, because some of these the job scope involves shift work, so there may be like a bit more allowance. Okay, so maybe what we see from the trend is that generally in the manufacturing industry, the pay could be slightly higher compared to hospitals. I mean, compared to like say working as a PT. But then again, the scope of work is different. The work say hours and all that is different. One you have to do shift. The other one, it's there is no shift. Okay, so I think for manufacturing, if you take into consideration like the shift allowance, transport allowance, because they are far away, right? Like say in Tuas, so that may actually affect the baseline income lah, when you first join the industry. Yeah. Maybe I also want to say it doesn't mean that you will be guaranteed a good income if you go into university. You get what I'm trying to say? It also depends on, let's say after graduation, you should, after graduation from polytechnic, you join a company, you build your experience, you build you accumulate your experience, and then later on you move on from one company to another company. Then that is your progression as well, and your progression will also help you with will definitely also in a way impact the income lah. Yeah, so I won't say that 100% if you go into uni means your pay will be better. Yeah, so it actually depends on the nature lah of each job and the industry.
Okay, the next question is, how do I become a research scientist after graduating from TP?
Okay, so here the keyword here is research scientist. So research scientists will be working in a research lab, right? Generally for research scientists, I would think the pathway is quite straightforward lah. Okay, so if you really want to be a research scientist, means you are in charge of, like say, it can be that you are managing the lab where you have a group of people working under you, a group of researchers or what we call postdocs, graduate students, research assistant working under you. Then to be a research scientist, you will need to have a PhD to be the position of a research scientist. I mean, if I understand the term research scientist correctly lah. Okay, so usually after, let's say from poly, some of our students do go into, like say they go on to do a degree. After they finish their degree, then they went on to do, say, a master's or a PhD. Okay, so after a bachelor, you can either go for direct PhD, means straight away you commit like 4 years of PhD, or you can do masters. After masters 2 years, then you continue your masters to a PhD, which could be another like 2 or 3 years. Okay, but a research scientist usually is a PhD holder, so you will need to work your finish your degree, then do your master or straight away do your PhD. Then after that, usually you will need to also gain a few years of experience as a research fellow, or what we call postdoc. then usually from there, they can start to, work on their own research area, research topics, set up their own lab, write grants, hire people, then work as a research scientist lah. But of course, there are in some companies, there are also research scientists where, especially in the say R&D in pharmaceutical companies, so the research is already in a way funded lah. So in that way, you don't have to apply for your own funding, right? Unlike in the NUS or NTU where the researchers needs to constantly write grants to get money to fund their research. Yeah. So I hope I clarified that question.
Okay, yeah. Yes, I think so. Yeah. What are the job prospects after poly before uni?
Job prospect, I think this one probably I shared just now. The various sectors like healthcare, manufacturing, pharmaceutical sales and marketing, testing labs, regulatory, even clinical trials. Yeah. So I think I covered that just now also.
Thank you, Dr. Maisha. So now we're at our final category. If your questions did not appear in the previous categories, do submit any questions that you have through Pigeonhole. So we have a little bit more questions for you, Dr. Maisha, as you can see over here. So what are some of the more common university and respective courses that people have gone to, our seniors have gone to?
Definitely, I would say many of you, when you're join Pharm Science, right, you aspire to maybe say be a pharmacist. So later you will take on you would want to further your studies in pharmacy. So pharmacy, is one university program that many of our students aspire to take. But I mean, locally, in Singapore, pharmacy is only offered by NUS. Okay, and it is a very competitive course. Okay, so that's one. Of course, NUS also in the last few years also launched the Pharmaceutical Science. I think there's a question on that, so I think I will elaborate a little bit more on that later. Okay, so Pharmaceutical Science. So these are also some of the programs that are our students take also overseas. Okay, so some of these programs that I say, there are students who do it locally. There are also some students who went on to do overseas studies. Okay, but increasingly, what I have observed in the last few years is that because I think a lot of our, many of you, when you come into Pharm Science, it's because you all want to be, say, part of the healthcare industry. You want to be, do you want to work in healthcare? So of course, pharmacy technician is one, pharmacist is one, but there is so many other allied health professions in the healthcare industry, which is why I think we do see a lot of our graduates going into other allied health profession after Pharm Science diploma. And definitely what they have learned in Pharm Science diploma will be helpful for them when they take on this other allied health program when they do their uni, because they are also working with patients, right? And of course, the drug knowledge and all that will be helpful for them when they do the other allied health program. Okay, so what are the allied health program? I have seen in the last, especially this year's graduates, quite a number of them go into nursing. We also have quite a number of students going into the various allied health programs offered by SIT, okay, like physiotherapy, occupational therapy, diagnostic radiography, yeah, so and radiotherapy, so radiography. So these are some of the courses that I've observed that many of our graduates, are going into in recent years. These programs are relatively new, offered by SIT. Okay, so those are the allied health program. We also have quite a number of students going into pharmaceutical engineering, also offered by SIT. Okay, so I'm sure all of you would have heard of SIT. Okay, SIT, there's different campuses all around Singapore, all very closely, closely located next to Poly. The purpose, the reason is because SIT is actually established to provide, another sort of like education pathway for poly students. You will see that their curriculum, right, is also very applied. There's a lot of hands-on, a lot of like industry attachment, things like that. Okay, and our students who have gone and do I don't think for the allied health program, the first batch of students have graduated because it's still relatively new. But for the pharmaceutical engineering program in SIT, many of our students have already graduated, and they are all now in the industry and all doing very well. Okay, so these are some of the programs that I think a lot of our students are applying to. Of course, there is also like things like NUS Life Science, NTU Biological Science, biochemistry, or even just pure chemistry. Yeah. So yeah, again, please join the webinars next week because really, like every when students are in year 3, then we start seeing students coming to ask us, what are the programs that are, that we can go into, and which is why we always engage our, universities partners to do sharing with our students, because I mean, of course, you can go and read up online and all that, but having the faculty members to speak to you, you can get some of our questions answered. Yeah, so I encourage you really to go and attend those webinars because it's really very helpful. It at least gives you what are the different options that are available to you. Okay, yeah.
Okay. The next question is very interesting. So I think this question is from an international student, and the international student asks, if he receives a tuition grant and it's bonded for 3 years to a Singaporean company, what can he or she do to seek help to secure a place?
I mean, for the course team, what we do is we do actively, share career opportunities with our students. I mean, not just for international students, but of course, we understand for international students, there is a bond that they will need to fulfill after graduating. So besides the opportunities that we share, if let's say, I mean, it also depends on the hiring companies, because of certain because for foreign students, you will need to the companies will need to issue the employment pass. So that is actually, I think, the part where can be challenging. Okay, but definitely, what schools can do to support is if you need help, do come and approach us. We can also direct you to our colleagues from SSCS to help you. We understand in the current pandemic, actually, many of our students are. I mean, we do have a few foreign students who may find a little bit more challenging to secure a job. Okay, because what we hear is that a lot of these companies are unable to issue the employment pass. But having said that, I do have students who also have successfully gotten a job and gotten the employment pass. Okay, so I think it really depends on the companies. Yeah, I mean, there are a lot of things that is also not within our control. Okay, but definitely reach out to us so that we can share opportunities with you, and then also get support from our colleagues from the student services. SSCS stands for Student Support and Career Services. Is it SSCS? Yes, correct. All right. Yeah.
Okay, so the next question asks that, if I'm working in a pharmacy sector after Polytechnic, what are the chances that, I can get a uni scholarship?
Uni scholarship. I'm not so sure. Okay, so this question means that that means while working, I mean, I'm trying to interpret this question. Does it mean that the hospital or the place that the person is working in, can offer a scholarship to the person? So again, this depends on, I think, the organization. I understand some organizations do sponsor their staff for universities, like they sponsor their tuition fees. But of course, that is in a way like, they are still working, and then they maybe do on a part-time basis, or it could be that they do full-time, but then they may be bonded to the company. Yeah, so I've heard of such kind of opportunities for the student. I mean, for those alumni lah, who are working and also being offered a scholarship. Yeah. Besides this, university scholarship, there's actually also a lot of work and learn programs, work and study programs, where you'll be enrolled in a program whereby you will be hired or employed by a company, okay, and then the company also sponsor your training, so that when you go for training, it's like to upskill you, to the training will prepare the staff for certain very specialized job role in the company. So they may spend like 3 months studying, and then the remaining part of the program where they will do on the job training. Okay, so these are the work study kind of programs, which are TP has there is one program known as the professional conversion program in biopharmaceutical manufacturing, where students are employed by, like, say, GSK, AbbVie, and then the company sponsor them for this work study program. Okay, so it is something that you all should also, again, it is an alternative pathway. So I think it's important for you all to know that maybe many of you is like, oh, go to work or university. But actually, there's other pathway as well, where you can, help you to upgrade and also upskill yourself, not just university or work. There's actually all these work study program, where you can, work at the same time, study and, upskill yourself. Yep.
So the next question is for probably the year twos. So for the year three, do they get any help finding the positions, or do they have to go around looking out for themselves?
We would like our students to take ownership of, because I think this is very important. But I mean, having said that, we do definitely the SIP coordinator, will help students to secure internship. But of course, we want to make sure that as much as possible, we do a best match. So there are like surveys that students have to do prior to doing the internship placements, so that we can see best match the student to a particular placement. We also need to see whether based on what we know about you, whether or not will you be more suitable for one particular job scope compared to another job scope. Okay, so which is why it's very important for us to know you also, and to be, you should be more interactive in class so that we know you better, right? Okay, but of course we do share what are the available placements, and we do ask students to sort of like apply. Not apply directly to the internship company, but apply to us first. So we are sort of like still like the middle man lah, then we will then help students to arrange for the interviews. Okay, so but we have students, and we encourage students to, if you want to self-source means you go and find your internship placement. If you want to do that, sure, by all means, but we always tell students to keep us in the loop. Just let us know, so that we know who you are liaising with, which company are you liaising with, so that we don't like duplicate lah. Like, for example, we already working with this company, then you go and approach them, then it may not be like very professional lah. Yeah. Okay, so but if you would like to self-source, do let us know. But we definitely will help our students. We will help ensure that all students will get a placement for their internship. Okay. Having said that, I would also want to remind students is to not take this for granted, right? Every internship placement is how to say, in a way, the course team, our internship coordinator works very closely with our industry partners. We don't just like anyhow say, they are looking for interns at any company. We just say, okay, sure. But we want to look at what is the job scope, whether or not the internship will be useful or meaningful. Okay, but having said that, I think it's important to have this mindset that you internship is really for you to apply what you have learned, but at the same time is to gain new knowledge, gain new skills, gain skills outside what you learn in school. Okay, so that mindset is very important. You must be very open to learning. You cannot say that, my school never teach me this, then I don't want to work. This is not within my job scope. Or, do paperwork. No, I don't want to do paperwork. So I think the mindset is very, very important. Okay, yeah, I think I deviate a little bit from the question, but I think what I want to say is to not take internship, while the school helps you, we want all our students to have a meaningful internship. So it is important to know, to manage your expectations lah, when you go out for internships, so that you don't, take the placements for granted. Okay.
Okay, so it's like, the school will help you, but if you want to look for yourself, you also can look for yourself, right?
Sure. We believe that when you had to source for your own internship, right, you will then understand the pain, not say pain lah, but there is a lot of things that is done at the back end that students don't see. There's a lot of communications between the companies and the student, I'm sorry, the company and the SIP coordinator. There's a lot of all these things going on behind the scene. It's not as so straightforward as it is. But if the students self-source, then they will realize that, it doesn't mean that you approach somebody, they will surely reply you, right? Same thing when you go out for work next time, right? You're going to be sending out a lot of job resume. The reality is you're not going to get a response every time, right? So it's yeah lah. So we encourage, if you would like to self-source, sure, but just let us know.
Thank you. So the next question, Mark.
I will just say, okay, what does it mean to remod a certain module?
Remod means redo. Okay, usually this happens when, if you don't clear a subject, you have to repeat the subject. So that I think we call it like second attempt lah, right? But I think all of you always say, like, you always say remod, right? Yeah. So yeah. So basically, if you don't clear a subject, then you need to do a second attempt to clear it, because all the subjects in the curriculum are part of your graduation requirement. There are certain things that you need to fulfill in order to graduate. So all your core modules, all the electives, all these are the requirement for graduation. Yeah. So remod means if you don't pass, then you redo. I know some students actually will also ask, if I don't get a good grade, can I remod? I believe some students ask that kind of questions, right? So all the modules that you take, it doesn't mean that if you don't do well, then, straight away whatever you take, you're accumulating CU, and then the CGPA and all that is calculated based on the total CUs and also, the grades lah. So it's not really worth it to go and repeat a module when you actually have passed. Okay, so I want to encourage you all is that the CGPA, I know, is a number, but this number is very important to all of you. But don't be overly, like, how to say? Don't be trapped by this number, right? Because when you are just, like, say, aiming for the CGPA 4 or like maintaining the CGPA, it actually adds on a lot of pressure and stress to yourself, and in a way, then you miss the whole point of learning. You lose out on the fun of learning. I don't know whether you all associate fun with learning like in the first place, but learning is supposed to be fun, right? Okay, you should enjoy what you're doing, and so what I want to encourage you all is, if you don't do well for one semester, don't just straight away say, then cannot already, I want to change course, I want to give up, because I have really seen students' CGPA improve a lot, even though their first semester is like, the CGPA may not be very good. So what is important is you don't give up, you continue to work hard, and if you do well for the subsequent semester, you can see that you can still improve your CGPA. It doesn't mean that one semester of bad CGPA will mean it's the end. And again, I have emphasized so many times, CGPA, yes, is one thing that they look into, but besides CGPA, there are also other things that employers will look at, you know, your soft skills, things like that. And all this is what really differentiate you from another person also. Okay, so I really want to encourage. I know, you know, results were out like last few weeks, right? So some of you may be very disappointed. You know, for those that have done well, of course, you know, keep it up, good, you know. But those who have, you feel like you didn't meet your expectations, don't be discouraged, you know, because you can still do well in the next few semester, and you can still improve on your CGPA, right? So I just want to encourage all of you to continue to work hard, and of course, where you need help, you know, please reach out to us. You know, let us know. We will sit down with you and then see how we can better support you, right?
So CGPA is not everything, everyone. So just now I remember you mentioned that like NUS offers pharmacy and pharmaceutical science, right? So like what are the main differences?
Um, yeah, so many of you may be like very confused, right, between pharm science and pharmacy. In fact, like diploma in pharm science, I think I've shared like it's quite broad based, right? It you know, provides you training, clinical, a bit industry. But if you talk about, say, like I use NUS as an example lah. You know, NUS offer pharmaceutical science and pharmacy. Okay, so for pharmacy is more clinical. The focus is more clinical. You will really learn a lot about, you know, the different drugs used to treat the different, you know, diseases associated with the different system. You will learn about, you know, it's focused a lot on the pharmacotherapy aspect. Okay, how the different drugs are used to treat the different disease condition. And one important thing, of course, for pharmacy is if you want to be a pharmacist, you have to uh, take a pharmacy degree from a recognized university, okay, so that you can later later you can register with the Singapore Pharmacy Council to be a practicing pharmacy in Singapore. So for diploma in pharm science, you know, when you come out of with the diploma in pharm science, you can work as a pharmacy technician. You cannot be a pharmacist, because a pharmacist, you have to go through, you know, a pharmacy degree. And in order to work as a pharmacist in Singapore, you need to you know, complete your pharmacy program offered by a recognized university. Of course, NUS is recognized, but like I said just now, some of your seniors, they went on to do their pharmacy degree overseas, right? So an important thing is to make sure that the degree offered by the university is recognized by the Singapore Pharmacy Council. Okay, so pharmacy will, you know, will allow you to work as a pharmacist, to become a registered pharmacist. So usually after the pharmacy program, right, after you complete the degree, you will still need to do a 1 year of pre-registration training in, you know, so that you can get your pharmacy's license. And this license has to be renewed like every 2 years. Okay, so like your lecturers, you know, like Miss Shahida, Miss Chua, Miss Hall, Miss Tan, they are all registered and licensed pharmacists. So yeah, so myself, I'm not a pharmacist. Okay, so my training is not in pharmacy. Yeah, so like I said, pharmacy is really more to more clinical, is to prepare the graduates for work in pharmacy, in a pharmacy setting. But although I say that, it doesn't mean you can only work as pharmacist next time lah. You can still use this knowledge to go into other pharmaceutical science sector. Doesn't mean that can only be pharmacists. It's not like that, okay? But for pharmaceutical science, which is launched, I think maybe 3 years ago. Okay, so pharmaceutical science is more, I would say, more industry oriented. It's more, okay, you think of pharmacy as more like, you know, directly interacting with patient. It's more like downstream. Pharmaceutical science is more upstream, meaning that, you know, it's like before the drug is being dispensed to the patient. There's a lot of work to be done before that, right? Drug discovery, drug development, drug discovery, you know, coming out of the formulation, testing out the formulation. Then when everything okay already, then go into production, then, you know, QC, so on and so forth. Then after the drug is manufactured, you have to go through registration, so that it can be, you know, a registered product. Okay, so pharmaceutical science is more industry oriented. Okay, the kind of subjects you do is less clinical. It will be more on like pharmaceutical analysis, medicinal chemistry, the different aspects of drug discovery and drug development. Yeah, and for a person that comes out of pharmaceutical science, this person will not be able to work as a pharmacist. Yeah, so that is one key difference. So it all depends because there are many, I mean, not say many lah, there are some people who graduated from pharmacy degree, but didn't proceed with the pre-registration training and then went into industry, went to do R&D research and all that. Okay, so again, like I say lah, doesn't mean that if you have a pharmacy degree means you can only be pharmacist. You can also actually still go into the other areas. Okay, so the bottom line is pharmacy is more clinical, pharmaceutical science is more industry oriented. And then pharmacy, you can become a pharmacist after you complete your pre-reg. For pharmaceutical science, you cannot be a pharmacist. Yeah.
So am I right to say that it's a little bit like our electives?
Yes. Something, yeah. Because yeah. So but of course for pharm science, at the end of the day, yeah, I think this is a very good question also because after diploma in pharm science, right? Like for example, if you take pharmacy practice elective cluster, you can go and intern at a hospital. Then if you choose pharmaceuticals and biologic, then you work in the manufacturing industry. Okay, but the thing is, there's no bearing, there's no registration, there's no like it's not a license because as of now, pharmacy technicians are not licensed. They are not regulated as of now. I understand that there could be plans in the future to regulate the profession as well, which is a good thing. Means you must complete a pharm science diploma in order to be a pharmacy technician, for example. Okay. So, but having said that, right, after you graduate from pharm science, say for example you decide to choose pharmaceuticals and biologics elective cluster, it doesn't mean you later cannot go and work in a hospital as PT. You can still do that because your year 1 and year 2 training will still equip you with the fundamental knowledge and core skills to work in a pharmacy. Yeah. Similarly, after internship, you work in a pharmacy, you realize that, actually I want to go into industry. You can also, go and after internship, go and, later on get a job in manufacturing. So which is why the diploma prepares our students for these different sectors. We don't so there's actually some flexibility lah. We don't like say you can only go into healthcare or you can only go into manufacturing. Yeah.
All right. So I remember my classmates going for this one in year 1. So do they see a possibility of going on a study trip when the COVID situation improves?
I also want to go. I think the last study trip we had was 2019. That was just before the year before COVID, right? So I mean, like I said, we are still actually in touch with our overseas industry, partners, our overseas universities partners, and like I miss them, they also miss us lah. So they miss having our students coming over to the university because I think it's definitely a very good opportunity for their academic staff to interact with our students and also interact with their students as well. And I mean for our students, definitely, I think the feedback is very positive. They learn a lot. They get to do like all the, visit the hospitals, visit the manufacturing industry, so on and so forth. Okay, so definitely we would like to resume the study trip. Okay, and I believe our partners, they are also very welcoming. Once the borders open, I think it's something that we will definitely want to resume that. I mean recently the news, right, they say that Australia is they are opening up their borders, right, but I think now it's only limited to their own citizens for them to travel out. Then later on, I think they will open up to foreign, I think students and also basically other people lah. Yeah. So hopefully we have usually our study trip is in September, so maybe in 1 year's time we can look forward to a possible study trip in 2022, all this is not possible, you know, it will not be possible unless everybody do our part lah. Because, you know, well, they allow us to go over, Singapore must also allow us to go, right? Yeah, so I think it's something that we will resume if the situation allow us to. So again, in the meantime, you can attend the webinars next week because all our partners are there, you know, like UQ, University of Queensland. Many of our students, sorry, I deviate a bit. In fact, because of COVID, it has also affected many of our students who want to pursue overseas studies. And there are students who actually went on to enroll into overseas course. Some of them actually managed to fly over to, you know, to start their program. Because some countries, their borders are open so they can go, like for example UK. But Australia, they are very tight. You know, their borders control is very tight. But we have some students who are actually enrolled in some of the programs, but they are doing it locally. So it's like home-based learning. So they do some of you know, maybe their year one in Singapore via home-based learning. Then once the measures, I think, you know, once the borders open, then I think they can go over there to complete their, you know, the remaining part of their studies. Okay, so yeah, if you know, like next week we have UQ, we have Griffith University, we have University of South Australia, UniSA, Otago, New Zealand. Yeah, so all of them are our partners. They used to come over to Singapore every year to give talks to our students also. So you know, I encourage you all to attend because then you can hear from them what are the programs. I think they will also be sharing about, you know, perhaps possible plans for students to go over, you know, like, yeah. So yeah, do sign up.
All right, so sign up for the Join Poly event. I guess.
We'll have to settle for virtual for the time being.
Yeah, so I hope all of you guys are also back. So welcome back. Unfortunately, due to time constraints, I think Dr. Maisha only has time to go through maybe 2 or 3 of them. So let's get right into it. Right. So for the first question, can you see?
Yes.
Right. Okay. So for our first question, wait, Dr. Maisha, you have announcements, right? Do you?
Oh, no. It's okay. I
No.
can do the questions.
Okay. Sorry. So for our first question, what are some scholarship opportunities overseas for students whose GPA is below 3.0?
I'm sorry, but it sounds like, you know, I keep selling the koyok, right? But I think this question, because it's overseas scholarships, right? I mean, based on the, you know, the meetings with our overseas partners, I understand that many of the overseas universities actually do offer scholarships for students. But of course, there are certain criteria. And the criteria may vary from universities to universities. Okay, so I can't give a correct, I mean, one answer to this lah. So what I suggest is really for you to, you know, attend the webinars next week, so you can hear from, you know, the various overseas universities and what are the scholarships that they offer. Then you see whether or not you can fulfill or meet the requirements. I understand some of them, when they are enrolled into the program, then they will be, you know, they can apply for the scholarships. Yeah. Okay. Locally, of course, there are also a lot of scholarships available for students. Some may be merit-based, meaning that they do look at CGPA. At this point, I also want to maybe highlight or recommend, you know, the MOHH scholarship, the Ministry of Health Holdings scholarship. If you are very keen to pursue allied health profession in the future, this is one scholarship that you can consider. You can basically, the scholarship covers the tuition fees and you will get to work in the healthcare sector. So over the last few years, many of our graduates have gotten this. I mean, every year we have about maybe two students who will be successfully awarded the scholarship, and not just in pharmacy, but in actually a range of allied health programs like dietitian. Recently this year, our graduate Clarice, she was awarded the MH scholarship and to pursue dietitian. Dietetics. Okay, and then last year we have Nuri, who is now doing diagnostic radiography. For students who are looking for sponsorship programs, Tan Tock Seng Hospital offers a healthcare sponsorship program, a study award for the year 1, year 2 students. If you would like to, you would like to pursue, your career as a pharmacy technician right after graduation, this is something that you can also consider. The sponsorship includes it will sponsor your tuition fee. It will also give you a monthly allowance. But more importantly is you will get to do internship with TTSH, and right after internship, you will be converted to a full-time employee. Okay. Again, next week, TTSH is giving the webinar. They will be sharing with students about the TTSH sponsorship as well. So do look out for our announcements also. We will put up when the application is open, we will also share with students. Yeah.
Okay, so for the next question, what are the chances of a current year 2 student to be able to go on an overseas trip if the situation gets better?
I think this one I explained right just now. We are looking at next year 2022, right? Unfortunately, the key is year 2 students, but year 2 students will be out for internship. So even if we can go, you may not be able to follow. Okay, so I'm so sorry about that. Well, unless if the borders open earlier, we can move forward our study trip. Yeah, it's a possibility. Okay, so yeah, I hope I answered this question.
Yeah, but it's unlikely lah.
If we move forward.
So the next question we have is, how do I develop my portfolio as a student with no CCA?
I mean, when you come to poly, right, of course, your aim is to graduate with a diploma with a good CGPA, right? But we always tell students, in poly, there's so many opportunities for you to develop yourself, not just academically, but also, holistically in your other areas. You have to make full use of these 3 years. And one way is to do CCA, right? Take up the CCA. But having said that, we always tell students, of course, if you have interest in certain arts or certain sports, then you can take up a CCA, and of course, if you have capacity to commit to the CCA. But if you don't have CCA, maybe you couldn't find something that you like, or you couldn't commit. There are also other ways. For example, participating in some of the programs that we arrange for our students. So we have things like the Industry Mentor Network program. We have study trip is also one way, because it gives students the opportunity to develop this global citizenship, things like that. Taking up appointments, volunteer to take up appointments in when we ask for class rep, assistant class rep, everybody keep quiet, right? Take the initiative to to volunteer. For TOPS is another way for you to build your portfolio, because TOPS is started for the purpose of giving our students the opportunities to develop their leadership qualities. Even if you are you don't think you can commit to be in, say, the main comm, right? You can also be a subcomm, or even just participate in the activities that are planned by TOPS. We also have community service projects, which we will also include all students. So be proactive, to participate in this kind of activities. And basically going for all these, additional things that the course team has arranged, because you never know, like when you attend this event, you get to meet people, you get to meet industry people, you get to network with them. And that's one way to also build your portfolio. Yeah, so the important thing is to be more proactive. And if we come to you to say, hey, we would like you to participate in a competition, or we'd like you to participate in something, do consider before saying no, because these are actually opportunities that we give to our students to help to build portfolio as well. So that's one way. TOPS always put up announcements and to call for people to come and join competitions, right? Like science basket. Sometimes they have some poster design poster competitions and all that. So take the initiative to participate. In the process, there will be something that you gain, and there will be something that you can say or write in your your job application, or your uni application. Yeah. If you don't have anything to say, then there's really nothing to say lah. You can just say that, oh, I finished a diploma, I got a GPA, this, then that's it. Right. There's no talking point lah, in a way. Yep. Maybe, sorry. I can take maybe one more question.
Okay. So thank you for plugging tops. But the next question we have is, what is the cutoff point to enter uni for either pharmacy or pharmaceutical science?
Okay, so if we're talking about locally, the I mentioned earlier, it's very competitive. Usually, the CGPA will, the CGPA requirement is quite high. I can't remember what is the exact number, but we are looking at definitely something above 3.8, 3.9. Okay. Having said that, CGPA is just one criteria. Of course, having a good CGPA will maybe put you in a good place, but what is actually important is also how you perform during the interviews. We have students who, maybe say like two students, the one who did not have may not have the best CGPA, may have gotten a place in the program because of, the interview, how he or she performed during the interview. Yeah, so the truth is local uni, the truth is lah, any program in local uni, definitely the requirement is, the entry requirement is higher. Okay. So you can consider other options. It can be, are these the only programs? Would you like to consider other programs? So I think it's important for you to plan. If you want to go into pharmacy, pharmaceutical science, you know that there's a certain CGPA, then of course you have to work hard towards it. But if let's say you are unable to meet the CGPA, then it doesn't mean that it stops there, right? You should always have, what is your plan B? Sometimes the end point is there, but different people have different ways to get there. So I think that is the important thing to remember lah. Yep.
Okay. Thank you, Dr. Maisha. Do you have any last announcements?
Yeah, I thought I wanted to share something, because just now we talk about interdisciplinary learning, right? So this is something that I think our students can look forward to in the coming semesters. In fact, the year twos have already had some experience with interdisciplinary learning where our students, ASC students, work with IIT students on the subject Innova. Okay, so what is interdisciplinary learning? I mean, you are in the farm science discipline. Okay, interdisciplinary means you actually acquire and integrate your farm science knowledge with another discipline. So it could be from IIT, can be from business, can be from engineering. Okay, so this is something that the school is working to provide more interdisciplinary learning opportunities. In fact, this is not something that just TP lah, but it's something that also the Minister Lawrence Wong have also mentioned in one of his speech that more and more there should be more disciplinary learning incorporated into the curriculum. Okay, so PHS has started interdisciplinary collaboration with IIT on the subject Innova. The year two students, you will also be, will look forward to interdisciplinary learning with IIT on, one of your subjects. So there will be a separate comm sessions for that. And definitely in the future, there will be more such opportunities like interdisciplinary major project. Okay, I think Jedediah, this one, yeah. Yes, okay, where you get the opportunity to work with people outside of your diploma, like with business school students, with IT students. So it's where you get to integrate knowledge from different disciplines to solve a problem. Because problems nowadays is no longer so straightforward, right? It's actually more complex. Okay, so that's where the interdisciplinary learning comes in. Okay, so I wanted to just say this because we are embarking on this interdisciplinary learning journey. Okay, I'm so sorry I cannot answer all your questions, but definitely what I think I can do is to get the questions from the organizers, and probably we can put it up onto Palette or something. I can address some of these questions, then you can share the link, and you can put up on LMS or something like that, so that some of the questions still get answered. Ken?
Okay, sure. Thank you, Dr. Maisha.
Thank you.
Thank you so much.
Okay. So thank you for your overwhelming questions. Due to time constraints, we will not be able to answer to every question. However, Dr. Maisha has said that she will answer them and get back to us. Okay, we would like to thank the fellow participants and Dr. Maisha for attending this event and making it possible. For attendees, do fill in the feedback form for attendance and any comments or improvement that should be made for future town hall events. Thank you for coming and hope you have find this event insightful. Have a great day ahead and see you back at school. Thank you.
Thank
Thank you,
you.
everyone. Enjoy your last week of holiday. Take care.
Thank you, Dr.
Bye.
Maisha.